Okay, usually we have music, so I was thinking we should have sung a song. Maybe we'll do that on the way out. All right, so good afternoon, students, parents, friends, and all our clinical and academic colleagues. Welcome to the Springfield College White Coat Ceremony. My name is Dr. Megan Mijon. I am the Springfield College PA Program Director, and I will be your Master of Ceremonies. Today, on this beautiful fall day, we gather to witness the class of 2023 take the physician assistant professional oath and don their short white coats. This is an important day for our students on the way to becoming PAs. We are all gathered here to acknowledge the hard work, dedication, and sacrifice of these students as they enter into the next pivotal months of their training. Students, this day is also important for your families, and it's especially important for your patients. The short white coat is a stepping stone to the long white coat. It is traditional for students of medicine to wear a short white coat, which has become a symbol of the caring professions. This is a step forward in the professional development of a student, and for physician assistants, it is a rite of passage. Traditionally, the white coat ceremony is held during National PA Week from October 6th to the 12th. The week of October 6th was chosen to commemorate the anniversary of the first ever graduating PA class from Duke University on October 6th, 1967. October 6th also happens to be the birth date of Dr. Eugene Steed, who was the founder of the PA profession. Today, these students spent the morning on East Campus doing team building activities and high ropes challenges. It was an opportunity to challenge oneself and maybe to step out of your comfort zone. It's just a taste of the mental and physical challenges that are awaiting you in medicine, especially during this COVID-19 pandemic. Before we continue, I would like to introduce the physician assistant faculty and staff team. Please hold your applause until the end. Assistant Professor Roxanne Sprague, Assistant Professor Christine Niedbala, Assistant Professor Lonnie Carney, Assistant Professor Andrew Baginski, our sign language interpreter for this afternoon, Assistant Professor Melinda Connors, Assistant Professor Dr. Jamie Moore, Dr. Rebecca Rosenstein, our medical director, Sarah Zukowski, our administrative associate, and Scott Kirkland, our simulation lab coordinator. I would also like to acknowledge several of our adjunct faculty who are here today. PAs Melissa Miles, Kelly Gilday, Sarah McGowan, Jennifer Alex, Dr. Luann McClowski, Seth Collins, and Dr. Carol Cohen. I am blessed to have such an amazing, creative, and hardworking team. They work day in and day out to prepare you all to be successful, strong, and confident PAs. In addition, I would like to recognize the members of our administration who have been instrumental in supporting us to creatively deliver the education our students need. Dr. Mary Beth Cooper, President of Springfield College, Dr. Martha Potvin, Provost and Vice President of Academic Affairs, Dr. Marianne Coughlin, Associate Vice President for Academic Affairs, Dr. Dean Hallowell, Dean of Health Sciences, and Dr. Slandy DeJuice, Vice President for Student Affairs. I would also, oh yes, go. I would also like to recognize Dr. Joel Cohen, one of the Springfield College PA program founders. His foresight about this budding career was clearly before his time. And now, it is my pleasure to introduce the president of Springfield College, Mary Beth Cooper, to welcome us here today.
Well, good afternoon. I'm so glad to be here. And I can see in the distance, and you may not be able to see, but if you turned around and looked at that red bike, you'd see a little chocolate lab. Jack has decided, our 5-year-old chocolate lab has decided to come to the ceremony today. He followed me up the hill, and so I don't think he's ever attended a college event before, but he's here. So he must know how important this day is. This is my very favorite fall event. Now, you might imagine that I would say that at every time I get in front of a group, and it's not the case. This is it. In fact, I'm in my 9th year, and in my first year here, I said, when's the short coat ceremony? And they said, well, the president usually doesn't go to that. And I was like, this president goes to that. We're going to come to this every year because this is big. This might even be bigger than when you get the long coat. Because for me, this is your entree into a whole new world. And now people will see you as we see you as professionals. And I said to Megan, I said, this is the last time I'm going to tell this story, I promise. I never wanted to be that president that tells the same story again and again. But then I realized that 40% of you haven't heard this story, and so I'm going to go with that. The other 60% that have heard this story, just nod off or do whatever you need to do. So healthcare is very, very personal, right? I mean, you care who actually takes care of you. It matters to you because your life is in their hands, or certainly your health is in their hands. And so all of a sudden you can think, this is a great program. Tell me more about the pass rate. Tell me how great our students are. But when you're in the hospital getting care, you want to make sure you've got the right healthcare provider. So 3 years ago, pre-pandemic, my husband had his, and this is, I'm not violating any HIPAA, I don't think, because he's not here, and I don't think, we are recording this, but whatever. He had his second hip replaced. He had his first hip replaced. I'd like to say he's much older than I am, but he's not, but he's having to replace parts more regularly than I am. So he had his second hip replaced, and we went into a hospital, and I'm not going to use any names. I'm going to try to be very, very careful. A PA came in, and she could have been new, and it could have been an off day for her, but she was distracted and a little bit, some things weren't working well for her. She was trying to set up a machine, and of course it was 6:30 in the morning, and everybody was a little anxious about what was ahead. And so she didn't actually help us as much as she could have, because she was, again, somewhat distracted and didn't have the strongest interpersonal skills. And I'm sure she is a wonderful PA now, doing great things. But I didn't have anything that said Springfield College on. I wasn't wearing a sweatshirt or anything. And I, of course, being the chatty person that I am, I said, so where'd you do your training? And she answered, and I said, oh, that's a great program. I'm sure you're well prepared for everything that's ahead. And then she walked out the room. About an hour later, a second PA comes in. Now again, I don't have anything that says Springfield College on me, nor does my husband. He was wearing a beautiful blue gown. And this PA came in. She walked right up to my husband, eye contact, spot on. Mr. Cooper, my name is X. I'm going to be taking care of you this morning. How are you doing? How do you feel? Are you anxious? Is there anything I can get for you? And it was a marked difference. She stepped out of the room, and I said to my husband, I said, okay, now we've been married 36 years, so we have this great repertoire. I'm like, I'm going to bet you that that person is a Springfield College grad. And he's like, how can you tell? I said, I can tell by the way she addressed you as the patient. She wanted to make sure you were her focal point, her strong interpersonal skills, the way she cared about you. I'm going to bet you $10. I know you're in a hospital bed, and you don't have any cash in the moment. I'll get it from you later. But I bet you she's a Springfield College grad. She walks back in, and very quietly I said, so where did you do your training? And she goes, oh, I'm a 2004 Springfield College grad. Yes! $10 to me, but I knew it. I knew the minute I saw her that these students in front of you are going to do the exact same thing. Eye contact, caring about the patient, delivering the very best personal care to people that are anxious about whatever is happening next. And so for me, it was just affirmation of what I already knew, that these are going to be the best healthcare providers that we can provide. And I wish you all good luck, and I can't wait to see you all wearing your short white coats. Congratulations. Thank you for letting me be here today.
Thank you very much, President Cooper. So we traditionally select a recent graduate as keynote speaker for the white coat ceremony to reflect on their experience transitioning from student status to provider status. This particular speaker was a standout student. His knowledge, compassion, and leadership demonstrated his commitment to the healthcare profession and his patients. Since he graduated, he has worked in inpatient surgery and is currently working at Convenient MD Urgent Care. I would now like to introduce our keynote speaker, Christopher Casey, PAC.
Thank you very much, Megan, and hello, everyone. Thank you for having me on such an exciting day. This ceremony marks just about the halfway point of the didactic portion of your PA school journey. Believe me when I tell you, I know how this feels. And family and friends, when your student tells you they were in the library for 12 plus hours each day on a Clin Med weekend, they only wish they were joking. But you have done what you needed to do to be here today. 4 years ago, I was in your seat, excited to be here, knowing that after today, I would be able to have my white coat on, interacting with real patients. And if you're like me, that excitement comes with the nerves of all this work you've been doing, essentially all on paper, being brought to life. There are a lot of firsts coming your way that will give you the same feeling. But there are also a lot of firsts that you have already conquered and moved on to have seconds, thirds, and many more, some of which you wish you wouldn't. Like your first anatomy cadaver lab, trying to dissociate the idea of a body being on the table while also trying to compare your textbook to the real thing right there in front of you, while at the same time getting to know that pungent smell of formaldehyde all too well. Or your first sim lab, trying to listen to Megan or Christine's voice through a robot patient while you have your own heart beating out of your chest, thinking about what you'll do or say next while they have you in that 5x5 room they put you in. Or your first Clin Med exam, since like I mentioned before, you just spent your entire weekend studying, that first 100 question lockdown browser exam will make you sweat, followed by the extra sweat that comes when that one student, because every class has one, finishes their exam in half the allotted time. Luckily for you, you made it to the other side of those firsts, alive and mostly well. They may have not have gone how you planned, but you were able to learn how to adjust and improve for the next one. That is what you will be doing for the rest of your career as a PA. Starting your career as a PA seems far away right now, but let me be the first to tell you, you will blink and you'll be graduated, blink again and you'll be seeing patients on your own, and blink one more time and you'll be giving a speech to the next generation of PAs. And even though you will have the title, you will still go through your own hurdle of firsts, some of which seem exciting in the beginning, like getting your first page, sending your first prescription, your first note completed and signed, followed by your name and PAC at the end of it, which, like many things, will dwindle in excitement after a while. But you will also have your first patient give you a genuine thank you, your first correct life-saving diagnosis, and something we cannot deny is very exciting, your first paycheck, all of which feel just as good 100 times later. Now, reminiscing on PA school and the transition to a career as a PA, there were a few things that kept coming up that I think are important points to share. First, you do not and will not know everything in medicine. You will have an excellent understanding of a lot of things, especially those common ones that you review in Clin Med, Sim Lab, or have projects on. When you're a new grad PA, you'll get comfortable with the stuff that you see often in the specialty you work in. But there will be stuff you have no idea what to do. And this is when you go back to your core training. You ask a detailed history. you do a detailed physical exam. You know sick versus not sick. You go back to the roots that you were trained with, and trained well, might I add. You discuss with your peers, and you refer to a specialist who will be able to help your patient. You don't always need to know the final answer, but you need to be able to guide your patient to the right place. Second, you will be asked a lot of questions in your medical training. In the medical world, these may be questions in the form of exams or maybe verbal questions that are sometimes referred to as pimping. These questions are asked, yes, to test your knowledge, but more importantly, to add to your knowledge that you already have. If you don't know the answer, go find out. Go learn about it. Turn that question into an opportunity to gain a little more information about a topic that you already know somewhat about. Doing this, especially throughout your rotations, will make you a better student and ultimately a better provider. Third, you are a person before you are a student. This is so much easier said than done, but find the things that you need to do to keep you grounded, to keep your mental health in check. You come first. You are also a person before you are a provider. Remember this when you are with your patients and you are hearing their stories. We have all been a patient, and you know how it feels to be treated like a number on a list, to be seen and not heard. You cannot be the best provider for your patients without being the best version of yourself there is. Lastly, make the best decision you can with the best information that you have at the time. This is something that I tell myself and I tell my patients when they ask me how to navigate this confusing time with constant changes. This means that a decision that you make today may not be the right one tomorrow when you have more information, and that's okay. When you have more information, there's a chance to adjust your perspective and make a new choice. I think this idea can be applied to medicine, but can also be applied to life. We tend to get worried and worked up about the unknowns, running every single scenario through our psyche, which almost 0% of the time creates a better outcome. All we can do consistently every day is make the best decision we can with the best information that we have at the time. You are about to face first after first, and that may seem really intimidating. Just know that the people you look up to, the people who teach you, the people who you will work side by side with have all done it, and you will too. So congratulations, class of 23, on your first white coat ceremony. Thank you.
Thank you, Chris. And as a token of our appreciation, I'm going to give you this gift because you don't have enough Springfield College PA program paraphernalia.
Thank you.
Thank you. All right, so we've come to the time in our ceremony when we will recognize each candidate with the donning of their short white coats. Each student has selected someone important to their education to assist in the donning of their short white coats. Professor Carney, will you please come forward to recognize the students and their selected coat donners?
Come on up. Go ahead, Hannah. The whole first row can come up. I need. Yes, one row at a time. Okay. Where's your people? The people? The people who are donning, if your person is over here, come on up, please. I apologize. That wasn't in the notes. Ready? Hannah Calabrese, donned by her mother, Lori Calabrese. Katie Campbell, donned by her grandmother, Marilyn Gelfand. Nicholas Coleman, donned by his mother, Sandra Coleman. Bianca Cohen, donned by her father, Timothy Cohen. Dina Dadul, donned by her father, Dr. Adnan Dadul. Marilyn Fay, donned by her father, Thomas Fay. Kyle Fernandez, donned by his sister, Emily Fernandez. Elena Grills, donned by her grandmother, Jeanette Tyler. Anna Calatina, donned by her sister, Ludmila Calatina. Rihanna Khalifa, donned by her father, Salim Khalifa. Gabrielle LeBeau, donned by her mother, Tina LeBeau. Ellie Lonis, donned by her father, Dr. Brian Lonis. Damian McKay Morgan, donned by his father, Linda McKay Morgan. Mother, I apologize. I knew I was going to do it once. Aksa Maham, donned by her father, Tahir Jamil. Lindsay McGowan, donned by her mother, Laura McGowan. Leah Mills, donned by her mother, Joanne Mills. Yes. Mackenzie Morris, donned by her mother, Melissa Morris. Eliza Moyer, donned by her mother, Sue Moyer. Taylor Nochick, donned by her mother, Kara Nochick. Kirsten Oliver, donned by her mother, Ginger Oliver. Garrett Osolinsky, donned by his mother, Lorraine Barton. Ryan Pelton, donned by his mother, Tracy Pelton. Mary Kate Pistana, donned by her mother, Kirsten Pistana. April Phelps, donned by her father, Matthew Phelps. Isabel Ripp, donned by her father, Christopher Ripp. Allison Rushlow, donned by her father, Don Rushlow. Ashley Rouleau, donned by her mother, Eileen Monahan. Christy Russo, donned by her mother, Sheila Russo. Emma Shea, donned by her mother, Lisa Shea. Victoria Skenesny, donned by her father, Zenek Skenesny. Kyle Supernat, donned by his sister, Caitlin Supernat, OT. Abigail Tantorsky, donned by her mother, Gail Tantorsky, PA. Alina Thopra, donned by her father, Bonus Thopra. Devin Valdez, donned by his mother, Virginia Valdez. Kimone Walker, donned by her mother, Dionne Walker. Kimiko Waisaki, donned by her mentor, Kayla Soja, PA. Final round of applause for the class.
All right. Congratulations. I know this isn't the first time you've put those coats on, but do they feel a little heavier, maybe? A little more weight to them, a little fresher? Okay, so now it is time for the administration of the physician assistant oath. PA students, please stand. I also welcome and encourage any other PAs here to stand and recite the PA oath with us. Professor Needbala, our history and physical instructor, will lead us in the recitation of the oath.
Please repeat each line after me. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor.
Nice job, guys. You can go ahead and be seated now. I would like to introduce Catherine Banks, Advisory Committee Member for Lifelong Learning, to present the Marilyn L. Cohen Award.
Well, it's very exciting to be here. You look so awesome in your white coats. I'm afraid I don't have any great stories like President Cooper, but since I just turned 80 years old, I'm sure there are many, many stories in my future with the PA students. So let me just give you a little background about this award. Many years ago, I was the Associate Dean of Students here at Springfield College, and I got to know both Marilyn Cohen and her husband, Joel. And Marilyn started the program that I'm in now, the Lifelong Learning Program, 55 and older. And as you know, her husband started the PA program. So when she passed away, our group wanted to honor her and decided that each year they would donate some money and select a student. And naturally, this is the program that they selected. And we've had so many wonderful recipients in the past. And each year I'm on in the committee, and I have to tell you that trying to select someone is always so difficult because all of the applicants are just amazing. So I have to tell you how hard it is. But we did select someone. And this is the plaque that person will get. And I'll read it to you. Springfield College Institute of Lifelong Learning presents the Marilyn Cohen Spirit Award in recognition of academic achievement in the Physician Assistant Program and service to others in the tradition of the Springfield College Humanics philosophy. And drum roll, please. The recipient is Bianca Cohen.
Thank you, Catherine, and congratulations, Bianca. Now, it is my pleasure to introduce Emeritus Professor John Hangaski to present the John and Suzanne Hangaski Scholarship Award.
Well, my name is John Hangaski. I was a faculty member here, and when I first arrived, Marilyn Cohen and Joe Cohen welcomed me to campus. Joel was my mentor, so I go back a few years. I also know where a few of the dead bodies are buried for the program. Upon my retirement in 2018, my wife and I decided to give back to the college, to the PA program, for everything that we had accomplished here in Massachusetts and in Maryland. So we started a scholarship foundation in 2018. The first award was given out in 2019, and it's a yearly award. So the monies that the interest derived off of came from my wife and myself, family, friends, colleagues, alumni, faculty, and staff. So this is something that is an ongoing scholarship. And unfortunately, we're only able to give out one award. And the winner of that award is Ms. April Phelps. Ms. Phelps. I've been vaccinated.
Thank you, John, and congratulations, April. Students, we are nearing the end of your white coat ceremony. Remember that your chosen career path is not merely a job, but rather a calling and a commitment to serving others. By donning these coats and taking this oath, you send a powerful message that you are willing and ready to dedicate your time, your efforts, and your knowledge to serving others. As you transition from didactic year to clinical rotations, do not perceive yourself as just a student. You are a valuable member of the healthcare team. Show compassion to all around you without displaying forms of bias. Wear your white coat with pride and keep it clean, which is kind of hard to do sometimes. Studies show that the white coat inspires confidence and trust among patients. Do not take advantage of this, however. Let it be an opportunity to learn that benefits both you and your patients. Remember that the path to success is usually challenging with many bumps in the road. Still, with hard work and dedication, you will get to the finish line. Your learning began last January, and it will never stop. As you continue with classroom learning and when you step out on rotations, be a sponge and absorb as much knowledge as possible. Be willing to learn from everyone, your instructors, the nurse who's been working for 30 years, the secretaries, your preceptor, and your patients. Everyone has something to share that can help mold you into the provider you are meant to be. I'll leave you with this inspirational quote. If you are not willing to learn, no one can help you. If you are determined to learn, no one can stop you. Congratulations, white coat recipients, on this important step in your journey. Thank you to everyone for joining us today. The students are now going to proceed out, and they're going to process over in front of Marsh for pictures and conversation. So students, you may now stand. Congratulations.